Bienvenidos a la Lección Magistral 2020, The Care System and Caregiving, Implications for an Aging Society. Comencemos con el desfile académico.
Buenos días, damas y caballeros. Señor Felipe Piazza, presidente interino de la Junta de Síndicos de la Universidad Interamericana de Puerto Rico. Distinguidos miembros de la Junta de Síndicos. Licenciado Manuel J. Fernós, presidente de la Universidad Interamericana de Puerto Rico. Señores vicepresidentes, profesora Marilina Weyland, rectora del recinto metropolitano. Doctor Richard Stefanacci, conferenciante invitado. Rectores de los demás recintos del sistema, presidentes y rectores de otras instituciones, señores decanos, doctor Melvin Rosario, presidente del 30º Senado Académico del Recinto Metropolitano, senadores, facultad, personal administrativo, invitados, muy buenos días. Damos inicio en este momento a los solemnes actos de la lección magistral del año académico 2020-21 en el Recinto Metropolitano de la Universidad Interamericana de Puerto Rico. Señora rectora del Recinto Metropolitano, profesora Marilina Weyland.
Señora decana de Asuntos Académicos del Recinto Metropolitano.
La Junta de Síndicos, el presidente de la institución, la administración, la facultad, los estudiantes y nuestros invitados se encuentran reunidos para escuchar la lección magistral del año académico 2020-21. Les solicitamos su autorización para iniciar los actos.
Señora decana de Asuntos Académicos, proceda usted con la ceremonia.
Comenzamos estos actos con la invocación, la cual está a cargo de la reverenda Ibelis Valentín, directora de la Oficina de Capellanía del recinto.
Comenzamos citando del texto bíblico en el libro de Levítico, capítulo 19, verso 32. Delante de las canas te pondrás en pie, honrarás al anciano y a tu Dios temerás. Oremos. Señor, en este día agradecemos y reconocemos tu presencia en nuestras vidas. Agradecemos que desde tiempos muy lejanos nos has mandado a honrar las canas, honrar a aquellos y aquellas que nos han precedido en el camino de la vida. Para honrar, Señor, esta encomienda tuya, venimos hoy aquí. A través de esta lección magistral esperamos que no solo podamos adquirir mayor conocimiento, sino que podamos renovar nuestro compromiso para contribuir a la calidad de vida de nuestros ancianos. Señor, tú quien eres precisamente llamado el anciano de días en el texto bíblico, permítenos verte y encontrarte en el rostro de cada anciano y cada anciana, en las historias que cuentan, en la sabiduría que comparten, que en sus voces encontremos tu consejo y tu acompañamiento, y que hoy quedemos con un compromiso renovado ante la misión que nos has encomendado. Que así nos ayude Dios.
La profesora Marilina Weyland, rectora del Recinto Metropolitano de la Universidad Interamericana de Puerto Rico, nos dirigirá un saludo.
Buenos días a todos, autoridades universitarias, miembros de la facultad, Dr. Richard Stefanacci. I would like to thank you for your participation in this year's magistral lecture. Traditionally, we get together at the beginning of each academic year to see each other after the summer recess, learn about an important issue, start an academic dialogue, and get inspiration for the year ahead. Today, we're doing so virtually, and we do appreciate your disposition to be here. When started to plan your visit to our campus, we were thinking of getting to know you personally, maybe some other time. El tema de discusión para esta lección ha estado muy cerca de mí durante el último año. He podido ver los problemas del sistema de salud actual y sus implicaciones para los enfermos y sus cuidadores. Yo lo veo como un rompecabezas cuyas piezas están desconectadas. Por un lado, está la medicina tratando de alargar la vida del paciente. Por otro, las aseguradoras tratando de proteger el costo más bajo posible, mientras el paciente procura la mejor calidad de vida posible y sus cuidadores tratan de armonizar entre todas esas partes. Procurar el cuidado y bienestar de los que nos necesitan es parte de nuestra naturaleza humana. Es una expresión de amor al prójimo que debe ser cultivada. Debemos trabajar colectivamente para armar todas las piezas del rompecabezas del cuidado de la salud, de tal forma que consigamos la calidad de vida del paciente y un balance de todos los demás factores que inciden en ese cuidado. Todo esto para nosotros es muy importante, considerando la distribución de edad de la población y el sector a lo que muchos de nosotros pertenecemos. Confío que podamos tener un buen año, que en algún momento podamos vernos y saludarnos personalmente, aunque sea a más de 6 pies de distancia, y que podamos tener éxito según confrontamos todos los retos que tenemos en Puerto Rico y en la educación superior. Mucho éxito.
Gracias por sus palabras, señora rectora. A continuación, el licenciado Manuel J. Fernós, presidente de la Universidad Interamericana de Puerto Rico, nos ofrecerá un saludo.
Muy buenos días. Me uno al saludo protocolar ofrecido por la maestra de ceremonias, la decana de estudios de este recinto metropolitano. Reciban todos y todas mi más afectuoso saludo y también reciban el aprecio y la admiración de toda la comunidad universitaria que compone la Universidad Interamericana de Puerto Rico. Estamos más que entusiasmados y felices de darles una bienvenida en este nuevo año académico, en el cual enfrentamos retos sin precedentes debido a la pandemia del coronavirus. Bienvenidos a esta tradicional lección magistral que marca nuevos comienzos y nuevas esperanzas. Hace un año, el Censo de Estados Unidos ofreció los estimados de la población por edad y sexo más recientes para Puerto Rico, en el que se resalta que la isla es la cuarta jurisdicción más longeva de Estados Unidos y que en 11 pueblos tienen una edad mediana de 45 años o más. En general, para Puerto Rico, el ritmo de envejecimiento apunta a ser uno acelerado, observándose que la mediana ha incrementado cerca de 6 años en lo que va de la década del 2010. La proporción de personas de edad avanzada también ha ido en incremento a través de los años, tendencia que se vincula a cambios en las variables demográficas de natalidad, mortalidad y migración. Los avances en la medicina, cambios en los hábitos alimentarios y cambios en los estilos de vida han ayudado a que el puertorriqueño de hoy en día tenga una expectativa de 78 años. ¿Cuántos retos suponen todos estos datos que podemos apreciar a simple vista? Como institución universitaria debemos estar al día en todos aquellos temas que trastocan el diario vivir y nuestra faena como institución educativa. Por eso, y mucho más, el tema que hoy nos concierne en esta lección magistral pretende dirigirnos hacia la mejor manera de enfocar esfuerzos educativos y de servicio social y comunitario hacia una sociedad envejecida. Today, we welcome you, Dr. Richard Stefanacci. Dr. Stefanacci is an expert on issues of geriatric medicine and considered a national expert on the programs of all-inclusive care for elderly for improving the care of the older adults. We are sure that the lesson given by Dr. Stefanacci to the faculty of the Metro Campus of the Inter-American University will be a transcendental for the continuous development of our community. Dr. Stefanacci, the Inter-American University of Puerto Rico receives you with great pleasure. Apreciado claustro, les exhorto a que disfrutemos y aprendamos de todo lo que aquí habrá de acontecer. Mucho éxito en este nuevo año académico y seguimos siempre adelante. Y que el Señor les bendiga.
Gracias, señor presidente, por sus palabras. A continuación, el señor Felipe Piazza, presidente interino de la Junta de Síndicos, nos dirigirá un saludo.
Muy buenos días a todos, que la paz de Dios sea con ustedes. Me uno al saludo protocolar ofrecido por la decana de estudios de este recinto metro. Para la Junta de Síndicos y para nuestra universidad constituye un gran honor recibir virtualmente al muy distinguido Dr. Richard G. Stefanacci, editor de la revista Caregiving for the Ages y miembro distinguido de la Sociedad Americana de Geriatría. Ha sido reconocido por el Colegio de Médicos de Filadelfia y recientemente recibió la Medalla de Honor de Humanismo en el Liderazgo de los Asuntos de la Vejez. Hoy él nos deleitará con su lección magistral The Care System and Caregiving, Implications for an Aging Society. Dr. Stefanacci, welcome to Puerto Rico. Our university is honored by your presence, and we are looking forward to receiving your research and wisdom. Por otro lado, a nombre de la Junta de Síndicos de la Universidad Interamericana, tengo la satisfacción de recibirlos virtualmente y agradezco su comparecencia a esta importante lección magistral. Quiero hacer patente que para nosotros es un gran logro que en estos momentos difíciles se esté llevando a cabo este importante encuentro académico, universitario y profesional. En la Universidad Interamericana de Puerto Rico estamos en la misma línea de pensamiento y trabajo del doctor Stefanacci, al reconocer que es imperativo cristalizar un esfuerzo y un enfoque multidisciplinario de trabajo en equipo para adelantar los servicios de salud y el cuidado a la población de las personas mayores. Como miembro activo que soy de esta generación, me da mucha esperanza saber que hay personas con el peritaje y la sabiduría, como el doctor Stefanacci, para juntar investigadores internacionales, nacionales y locales y discutir lo que es mejor para la generación a la que pertenezco. Entre otras cosas, nos causa mucha satisfacción que figuras como el doctor Stefanacci y sus colegas estén manejando los retos de las aplicaciones de los medicamentos y sus problemas relacionados dentro de la realidad crítica en que vivimos, particularmente aquí en Puerto Rico. La disertación de nuestro distinguido invitado resulta ser muy crítica dentro de la realidad presente en la que estamos enfrascados, porque nos ilumina a identificar políticas públicas y posibles cursos de acción a seguir. Es muy cierto que como sociedad tenemos que entrar en términos con las posibilidades reales de estos problemas, las cuales afectan a la población de personas mayores. Pensamos que se pueden prevenir como una manera de fortalecer la cultura de calidad en los sistemas de prestación de servicios de salud. En una expresión final, reafirmamos nuestra gratitud especial a todos los que participan en esta importante actividad y estamos seguros que la disertación del doctor Stefanacci será de máximo provecho para nosotros en la Universidad Interamericana y para Puerto Rico. Por tal motivo, enhorabuena, con entusiasmo y afecto recibimos al distinguido doctor Richard G. Stefanacci para que nos ilustre con su lección magistral sobre el tema de los servicios de salud en la población de personas mayores y otros temas relacionados. Que Dios les bendiga a todos.
Gracias, señor Piazza, por sus palabras. Me complace hacer la presentación del orador invitado. Dr. Richard G. Stefanacci is a geriatric medicine specialist who has focused his career on care delivery systems to improve health outcomes in frail older adults. He holds a doctorate in osteopathic medicine and a master's in geriatric health from A.T. Still University of Health Sciences and a master's in business administration from the Keller Graduate School of Management. Dr. Stefanacci completed his fellowship in geriatrics at the University of Medicine and Dentistry of New Jersey. He holds a faculty appointment at Thomas Jefferson College of Population Health, Philadelphia, and is the founding executive director of the University of the Sciences Health Policy Institute in Philadelphia. His research interest revolves around improving health outcomes and population health management of frail older adults. Having published more than 600 articles in professional and academic journals and delivered over 1,000 lectures, both nationally and internationally. Dr. Stefanacci is editor-in-chief of the Caring for the Ages Journal and serves on the editorial board of the Journal of Aging and Gerontology, Managed Care and Population Health, among others. He is considered a national expert on the programs of all-inclusive care for the elderly, known as PACE, a home and community-based program geared toward improving the care of frail older adults. Dr. Stefanacci is a member of the American Geriatric Society and has achieved recognition as a fellow on the College of Physicians of Philadelphia. He was recently presented with the Humanism in Aging Leadership Award from the University of New England and the Finestone Memorial for Geriatric Excellence Award from Temple University for his outstanding service and contributions to improve the lives of frail older adults. Dr. Stefanacci founded with his family and friends the Go for the Goal Foundation when his oldest son, Richard, was diagnosed with Ewing sarcoma. This foundation assists families of children battling cancer. Since its establishment, the foundation has raised several $1 million to assist hundreds of children affected by cancer at nearly 100 children's hospitals across the country, while also funding cutting-edge research to find a cure focused on improving care outcomes.
I'm so excited to be here today at La Inter, knowing a bit about the rich history of your university and your extremely bright future. I could not think of a better subject to explore today, although I'd much rather be in person with you. But by the end of this discussion, I'm sure you will find opportunities for us to get together again soon, to improve our care system and caregiving for our aging society. That's our topic today, the care system and caregiving, implications for an aging society. Some additional background from where my perspective comes, which I know you will find quite unique. This is me celebrating my birthday in my family's convalescent center in Passaic, New Jersey. This happened about the same time that La Inter was just being started. Things were a lot different back then, as you can imagine. You will notice the nurse with her nurse's cap in the center top, an elderly resident on the sofa carefully watching the celebration. Not only did I spend my 8th birthday at our long-term care facility, but every Sunday morning I helped transport residents to Mass, as well as serve as altar boy. This plus the entire summer vacation serving as an aide, housekeeping, maintenance, and therapy assistant. You can see I quite literally grew up in long-term care. And before you feel bad for me, my birthday is in December, and our facility, again, this was a convalescent center way back then, it was more like today's assisted living facilities. and we had an indoor Olympic-sized swimming pool, so not too bad a place to be in December for your 8th birthday with family and friends. This next slide is a slightly more recent photo. You may recognize your own Dr. Alex Casiento standing next to me as we celebrated the opening of our LIFE program, or Living Independent for Elders. The LIFE program is a full risk program where we serve not only as the provider, but as the payer as well. This model of provider and payer as one is termed payvider, for payer and provider. That's how we got payvider as a term. This is growing to become one of the most common care delivery models. In the LIFE program, we care for older adults that qualify to live in a nursing home, but live in the community. And we support them in all the care team efforts in caregiving to keep them safe in the community. And as such, we are fully responsible for all aspects of their health. So if we miss an opportunity to assist somebody in preventing a hip fracture, for example, managing their medication, or working on their end-of-life care goals, that's a significant loss for us because we're not only the provider, but the payer as well, that payvider term. So this is a picture or an illustration of the LIFE program, the center of which is an adult daycare center. And our participants come here for meals and activities and care. And you'll notice I actually use the word participants rather than patients or members. And the reason for that is that, again, the LIFE program, Living Independent for Elders, is meant to be an engaging program. So providers, and patients, that's more of a healthcare, acute care setting. So rather we use the term participants to illustrate those individuals that we're taking care of or we're working and participating in their care. Embedded in this is a video of a story of a participant that I took care of. Fairly common story within the PACE or LIFE programs. This individual was able to live alone in an apartment in Philadelphia, where otherwise he would be living in a nursing home. So much happier and healthier as a result of the caregiving and caregivers that the PACE program is actually able to bring to him. So again, it points out the importance of the caregiving and caregivers that we're able to provide. And that's really illustrated here. So this is the Quadruple Aim. It was initially the Triple Aim. This was developed by the Institute of Medicine, and they quickly realized that a significant component was missing. When looking at better health, lower cost, better care, none of those three critical aims is able to be accomplished without the caregiver. So soon after, the Triple Aim was abandoned for the Quadruple Aim, and caregivers was added to that. So again, the importance of caregivers being kind of a central point of being able to deliver those other three aims. Now, even more specifically, when I'm asked what professions or professionals are urgently needed for the foreseeable future, the answer is really illustrated on this slide, and that answer is those that are closest to those that need. And what I mean by that is it starts with the family members. An interesting point, we did some research a number of years ago, and the research looked at what was the factors that ended up somebody getting into a nursing home. So when you look at your life, whether you need long-term care insurance, the likelihood that you're going to wind up in a nursing home, the number one factor in your life which dictates whether or not you're going to wind up in a nursing home. So it doesn't have to do with something that me as a geriatrician are going to help, like dementia, ambulatory dysfunction, things like that. No, it's the number of daughters you have. So, and again, that points out the factor or the fact of the importance of the caregivers. The more daughters you have, the more the caregiver burden can be spread on to other individuals. So again, it points out that those closest to the loved one, and that is really the family caregivers first, but then nursing, social workers, aides, really close to rendering hands-on care. And then special care providers such as dietitians, therapists, and medical professionals such as myself, like geriatricians, and also administrators. But when asked again what professionals are urgently needed for the foreseeable future, The answer to that question is those that are closest to the ones in need: family, nurses, social workers, and aides. Now, this is an interesting slide. This is a screenshot of the classic 1971 film, Willy Wonka and the Chocolate Factory. Hard to believe that it was so long ago. And here we see, in this scene, young Charlie coming home to his parents and grandparents. And this is often the case where Charlie is typically the lone child left caring for 2 parents and 4 grandparents. This has come to be referred to as the 4-2-1 problem, or caregiver burden problem. And it's the situation where 4 grandparents, 2 parents are cared for by 1 adult child. As you can imagine, one place that this is very problematic is China, where because of the one-child rule, there's now, again, that situation of 1 child caring for 2 parents and 4 grandparents. But other places in the world, including here in Puerto Rico, this is, again, growing to be a problem. As we see on this slide here, this problem is getting worse with the number of young people shrinking and the number of older adults increasing. And you can see that significant increase in the number of older adults, especially older female adults. And you notice that that increase accelerated after the hurricane, where in Puerto Rico a significant number of younger adults left the island, leaving behind a frail older patient population. Another way to illustrate that is on this next slide. These are age bands. So here this illustrates, again, that shift where it used to be the case that we had a lot more younger adults caring for a fairly low percentage of older adults rather. So big population of young adults, smaller population of older adults. You can see that that's shifting, and we're having a smaller number of younger adults, and the number in need, the population of older adults, is growing. So before we had significant supply, against a very little demand. Now we have the opposite: low supply, significant demand. So it's really problematic and calls upon us to increase the number of providers or caregivers. So caregivers are critically important. And I've really gotten to appreciate that, through my involvement as a geriatrician growing up, again, in long-term care. But another aspect that I'd like to present to you that really shaped my perspective on caregiving, the important role of caregivers, unfortunately came through this situation. These are some photos of my oldest son, Richard, who was diagnosed with Ewing sarcoma and unfortunately passed away as a result of that. But through that journey, myself and my family recognized that the importance of caregiving and the stress on caregivers through this journey. And as a result of that, we developed the Go for the Goal Foundation that works and provides resources for family, caregivers, and children battling cancer. And as heart-wrenching as that story is, you're not even going to believe this part, but that bottom photo is my son Richard with his cousin Blake. Blake's my sister's daughter, one of 3. And Blake was also diagnosed with a pediatric cancer, rhabdomyosarcoma. So we had 2 out of 13 grandchildren affected by pediatric cancer. As you can imagine, you would think that it was genetic, given those extreme odds, but we did that research and it wasn't. Thankfully, Blake is doing fantastic. She's 10 years out from chemo. She's a happy sophomore at the University of Maryland, although she'd be happier if she was in class rather than doing this online as we're doing today. But I just tee this up because this, in addition, really formed my foundation of what's critically important for caregiving and caregivers. That really forms a foundation for not only caring for children battling cancer, but caring for older adults. So these rules remain the same. And these competencies or rules are spelled out by the acronym Who Cares Me. So we'll spend a few moments, or a few minutes rather, on each of the 7 core competencies for these foundational elements in caregiving. And we're going to highlight as we go through these 7, the role that technology plays in each of these 7 areas. So we start with W for wellness. So the core competency here is really being shaped by technology. So you can see a few illustrations there. The top photo is a gentleman wearing a belt. It looks like a big belt. That's because there's airbags in that belt. So what that does is that when it senses somebody's falling, it deploys airbags that prevent a hip fracture. So the benefit here in wellness is that through this technology, seniors feel more comfortable, and rather than being fearful and taking a walk and staying healthy and really focusing on their wellness, they're able to, put this belt on, feel comforted that if they are going to fall, that they're going to be safe from having a hip fracture. The other things illustrated there are things that monitor activity and also cardiac rhythm. And interesting story here, a few weeks ago, my father, who's an extremely active 90-year-old, actually plays golf once a week still, called me as he does every morning at 8 o'clock. And on this particular morning, said that he didn't feel that great and he was going to sit down and he'd call me later. I immediately knew that that was not normal for him. I called my brother-in-law who was nearby. He ran over with his iWatch, was able to put the iWatch on my father, and we were able to diagnose him with a cardiac arrhythmia, atrial fibrillation, an irregular heartbeat, which increases the risk, especially at 90, of having a stroke. So we were able to get him to the emergency room, get him anticoagulated, his blood thinned, so that it would prevent him from having a stroke. But without these technologies in this area, this first of the 7, wellness, you could see we'd be significantly disadvantaged. People like my father wouldn't have had that atrial fibrillation, that cardiac arrhythmia, diagnosed early, could have had a stroke. People that, are fearful of walking, and therefore kind of restrict their level of activity, now can get up and walk with the safety of wearing an airbag belt. So again, technology is really playing a role. And again, we'll touch upon that in each one of these 7. So first, W, wellness. Next is C for care coordination or coordination of care. And here we're seeing a real change. Care historically had been very fragmented. Multiple specialists, especially dealing with cancer patients or older adults, multiple care settings, home, nursing home or skilled nursing facility, seeing the primary care physician specialist. And what I illustrated there on the bottom is the ability through electronic health records, e-consults, and others to really coordinate care. So rather than this fragment, we're able to provide, through the use of technology, care that's coordinated, and as a result, efficient and effective. We're eliminating a lot of waste. Without care being coordinated, transitions of care, things were being missed, or redundancy. You could have had an EKG done or an x-ray done in the emergency room yesterday, because care is not coordinated, you're at a different center today and they're repeating everything. So care coordination is definitely benefited through the use of technology. Next up is A, and the A here stands for acute care. And this is an interesting illustration. This is from the Jetsons, 1960s TV show. So again, back to the beginning of La Inter as a university. And despite this being 60 years ago, Elroy was examined at home by his physician through a telemedicine visit. So again, we're increasingly seeing more and more care being driven and provided at home. And especially with COVID, unfortunately, I'm not able to be with you today, but what we're seeing is that I'm doing more telemedicine visits so my patients can stay at home rather than having to come to the office. That's illustrated again by that rabbit there. Everything has to have a catchy name and logo to be embraced and utilized as a system. That stands for Rapid Assessment Initial Treatment. So what that means is that we send patients to the emergency room, urgent care, where we do a home assessment, get them rapidly assessed by paramedics or other systems, and treatment initially started, whether it be IV antibiotics, and care continued at home. So again, acute care management definitely benefiting from technology and definitely being driven more and more towards care at home. Next up is R, and I cheated a little bit here because R, I used it as for RX for medication. increasingly older adults are on multiple medications. In the PACE or LIFE program, our participants are on average 13 or more medications. And you can imagine an older adult with some level of cognitive impairment trying to manage 13 medications. The likelihood is that they're not going to be that successful with that. So for a lot of our participants, we utilize the medication management system. So that's one illustrated there. So that system will say, Mrs. Jones, it's 8 o'clock in the morning, time for your morning medications, press the blue button. Mrs. Jones presses the blue button, her medications come out. If she doesn't, which is often the case, she'll get a phone call from the machine. If she doesn't respond to the phone call, her daughter will get a phone call because, again, it's always the daughters as the primary caregivers. And if the daughter doesn't respond, I'll get a phone call as the primary care provider. In addition to that, the system also helps manage changes in medication dosing. So if I have a patient, for example, or a participant that's on a blood thinner, and their blood is too thin and I want to hold the dose, and I just keep my fingers crossed that they remember not to take it that day. With this system, I could key in my office for them not to get that dose that night. So it manages medication changes. And finally, the other thing that it does, which is interesting, is PRN or as needed medications. So if I have somebody on a sleeping medication, for example, and they take their medication and they forgot they took it and want to take another one, or a pain medication that they want to take too soon, it'll block them from doing that. So if I say a medication is only once a day or every 6 hours, it won't allow them to get that dose until that time period. So again, through the use of technology, especially with our frail older adults that are on multiple medications, and that's an illustration there of Dr. Seuss, You're Only Old Once. So that really illustrates kind of the complicated nature of patients trying to manage their medications on their own. Also points out the fact of how important the caregivers are, and if they don't have that medication management system, the caregiver is playing a key role in managing those meds for individuals. Next up is E, and the E stands for end of life. And historically, we've done a really poor job in end-of-life management. You know, when you look at the data, a significant amount of resources are spent in the last weeks and days of life. Still a significant number of older adults die in the hospital, which is really sad because when I talk to my patients and ask them, you know, where do they want to pass away, it's never in the ICU unit. It's always at home, surrounded by loved ones, comfortable and not in pain. Yet, all too often we miss that. Technology here can play a role too, in two ways. One, there's a lot of systems out there that assist in getting advanced directives or living wills completed online, can provide educational videos so that when it asks the question whether you want CPR, it'll illustrate what CPR is, because a lot of people only know it from television where most people survive, which is clearly not the case. The other thing technology can do is that it can store your living will in the cloud so that when somebody winds up in the emergency room without their advanced directive, it's easily accessible. So again, end of life and really kind of focusing there is a really big opportunity. And again, one that's again benefiting through technology. The S, as we come to near the end of our 7, stands for social determinants of health. And this even is being addressed by technology. So that's an illustration there of Aunt Bertha. That's a system that when we identify a need for an older adult in those areas of social determinants of health, such as housing, transportation, food, I can plug that in and look at what available resources there are in the community. And not only kind of a yellow page listing of those activities, but I could link my older adult, my participant, with those resources, either making an appointment or a referral that food bank or transportation service will get, and they can reach back out to that older adult and make that link. And I'll get feedback that it's been accomplished, again, that we could fill these increasingly important and critical social determinants of health. So, and finally, of the 7 in Who Cares Me is MA or M for mental health. And, again, unfortunately, because of COVID, we're seeing an increasing level of stress and mental health issues. especially amongst our frail older adults. And here even technology again is playing a critical role. Due to the limited number of mental health providers, we're able to utilize them really efficiently and effectively through the use of technology. So rather than them running around seeing a bunch of participants or patients, they could see an increasing number more effectively online. And there's even apps and online resources that one can utilize to help alleviate some of the stress and mental health issues that one's battling with. And on that note of mental health, I just wanted to tee this up for you. This is a slide that illustrates a modification of Maslow's hierarchy of needs. And why this is important as the university gets involved in the community. Again, on the foundation of that is basic medical care. So that who cares me, the 7 that we just went over. Then within a facility, obviously, is room and board. But the higher part of that, those mental health pieces of developing and growing a community, as well as that important point of having individuals being able to realize accomplishments, that's critically important. One of the communities I serve, which is a lot different than a lot of long-term care communities and facilities I go to, where it's kind of devout or absent of any of that sense of community or the ability for residents to realize accomplishments. One is a convent with 240 nuns that's basically a skilled nursing facility. And they have, a true sense of community, and they really work at it each and every day to instill that sense of community, as well as multiple opportunities through different activities, teaching, still with bringing in community children that they tutor, and they actually get paid for. They have a candy shop, they have a garden, so where they can really realize accomplishments. So again, in that last of the who cares me, that ME for mental health, this is again kind of looking at that Maslow hierarchy of needs and modifying it for that long-term care and really helping to develop a sense of community and opportunities to realize accomplishments. So again, when we look back at the rules governing the competency for caregiving and caregivers, they're really captured well in this who cares me. Again, wellness, coordination of care or care coordination, acute care, RX or medication management, end-of-life care, social determinants of health, and mental health. So keeping in mind these 7, and again, the role of technology increasingly can play in each of these 7 areas. So finally, in closing, as a geriatrician, I'd be remiss if I didn't force you to remember 3 things. So here on this slide, it's not a memory test. It's not a memory test for your cognition, but a foundation to continue this journey that we're starting today. So the first one of the key takeaways comes from Pablo Picasso, or a quote from Pablo Picasso that I really like, and I think really will give you a sense of, what we can accomplish in this journey. So his quote is, "Learn the rules like a pro so that you can break them like an artist." So Picasso was educated on the rules of painting, but given the freedom to create pieces that really moved people. So you can see one of his early works there that really understands and appreciates in excruciating detail the rules of painting, composition, color, lighting. And then later in his life, where he will tell you that he truly became an artist, he broke those rules. And there's one of his more famous paintings, The Three Musicians. And you could really see his artistic freedom being expressed there in a piece that I think truly moves our world, and something that we could do in moving to, or making rather, this a better place for all of us. So there's really a difference to be appreciated here. Number 2 of those 3 things to remember centers around the rules. So again, making sure our students understand the rules. And again, those rules are illustrated in that quadruple aim with terms like payvider as the payer and provider, like in our Life PACE program, become more central to care delivery. Up at the top there is the importance of caregivers that we've stressed throughout this discussion today. Illustrated there is the patient experience, which increasingly is occurring at home. Down at the bottom there is cost, or really moving from volume-based fee-for-service to value-based total cost of care. And then on the left-hand side there is our 7 key competencies, illustrated by Who Cares Me? Wellness, care coordination, acute care, RX management, end of life, social determinants of health, and mental health. And then finally, of the 3 key takeaways, centers around art. So promoting creativity. So here's an example of promoting creativity that you could take and utilize in your classes. So this is something that I use in my classes. So this is borrowed from Amazon. So rather than PowerPoints, Amazon forces individuals that want to articulate a new idea or new program to develop that into a future press release. So you can see the rules there. It explains what's important, sets an ambitious and a clear goal, and outlines the principles used that led to success. So, much like the great works of Picasso accomplished after learning the rules, he was able to express himself through his art in different, unique ways. And in doing so, truly move the world to a better place, which is ultimately what we all strive for. So again, remember these 3 key takeaways. Learn the rules like a pro so you can break them like an artist. The rules of the quadruple aim, especially in terms of caregiving, caregivers, and technology. And then think like an artist. And to that end, I'd like to conclude with an offer for an ongoing collaboration between myself and all of you. Please reach out to me for assistance around the rules governing our ever-changing healthcare environment, because they're increasingly complex, and I'd be happy to help you in educating and translating that for your students. And then also ways that we can create art and artists so that we can improve the health of our older adults. So thanks for the opportunity today, and more importantly, for future opportunities to work together in the future. Thanks, everyone.
Dr. Richard G. Stefanacci, the Board of Trustees, the President of the Inter-American University of Puerto Rico, the Chancellor, and the university community, thank you for your message and for your participation in this event. Para concluir la ceremonia, el reverendo Gerson Serrano, capellán de la Escuela de Cedín Superior, ofrecerá la bendición de estos actos. Agradecemos a todos su presencia en los mismos. Buenos días.
Recibimos la bendición de Dios. Y que el amor y el cuidado de Dios cubra todas las vidas, en especial las de las más vulnerables. Que la gracia y compasión de Jesucristo produzca en nuestras vidas acciones que promuevan el bienestar y la calidad de vida de todos y todas. Y que el consuelo y la fortaleza del Espíritu Santo acompañe a todos sus hijos e hijas. Que el Trino Dios, el Padre, Hijo y Espíritu Santo, nos acompañe en este día y siempre. Amén.